Welcome to my channel. This is Miriam, nurse practitioner. Today we're going to talk about questions to ask before accepting that job offer. Questions to ask before you accept that job offer, especially new nurses, new nurse practitioners, because you want to know some of these things. You don't just want to sign on a dotted line for any job. The first thing you want to know is that, is this position going to be a W-2 or W-9, aka 1099? So a W-2, of course, is that you're going to be entitled to benefits that are going to pay majority of your taxes, at a different rate. And you are also going to be considered a full-time or part-time with benefits employee. But if you're going to be a W-99 or a 1099, it's a whole different ball game. So you want to know the difference. If you're going to be a 1099 employee and nurse practitioner working 1099, that means that they're going to pay you a little bit higher, but then you'll be responsible for higher rates of taxes. And of course, you'll not have any benefits like vacations, sick days, things like that. So you want to make sure you are clear about the position before you accept it. And then, what is required of this position? What exactly am I supposed to be doing? You want to know. Of course, you want to know that before you even apply, but you also want to be clear before you accept the position. You want to be clear before you accept the position. So what is the schedule? What are the hours? Will I be working weekends? Do I get days off when I take calls on the weekend, or do I get paid for my being on call? What are the paid holidays? You need to know, because sometimes it's okay, 4th of July, but then you don't get paid unless you have some PTO time. So you want to know what is required to be on call. If I am on call, do I get on call pay? If so, how much is that on call pay? How often am I going to be on call? Is it going to be every month? Is it going to be every 6 weeks, every 2 months? I need to know that. You need to know that. So how about CME, continuing medical education? In one of the videos, we talked about continuing education, where you really want to make sure you are always learning, because the only time you stop learning is when you are dead, right? So you need to keep on learning. Just because you are a nurse practitioner for years doesn't mean that you should not continue learning, because there are always new developments, new technologies coming out. So are they offering that? If so, how much is it? Because sometimes some employers can offer you $1,500, $2,500, or $5,000 per year to attend continual medical education. So you need to know. And if so, when they offer you that money for that training, are you going to be paid for days to go and attend that training? So you need to know that. Because when that is not clear, then that's when people start getting confused about what's going on. How long will the orientation be? It's very important to know, especially if you are a young, newly graduated nurse practitioner. For instance, they should be able to tell you how many days or how many weeks you are going to be learning on their EMA, their electronic medical record training. Is that going to be a week? And if so, you need to know. Then after that, how long are you going to train with somebody? So you need to know that. And if so, how long are you training with somebody? How long are you going to start taking patients on your own? What that means is that, let's say I'm training with Nurse Linda for 2-3 weeks. Then the 4th week, okay, they're telling me I can start with 1 patient during an 8-hour period, 3 patients, 4 patients. I need to have an idea about that. In that way, it cuts down the frustration. And then who's going to be your resource person when you start taking? Is it going to be the same person that oriented you, or is it going to be another person? You need to know, because again, when you don't know these things, you go show up at the job, they give you 1 day in the electronic medical training, the next week they are giving you patients, and then you start getting frustrated. So you want to make sure you know that, so that you can make an informed decision. Is this what you want, or should you continue looking for another job? So will you be paid a full salary when you are in orientation? That has come up a lot now on social media. Oh, I've started a job, but they're telling me because I'm in orientation, they'll be paying me $40 an hour. And then after orientation, they'll start paying me the $65 an hour that they promised me. I'm not sure if they do the same for doctors, but you need to look into that because it's not good for us to be taken advantage that way. Make sure you know, am I going to be compensated the same when I'm in orientation or not? Because some people sometimes they get an excuse about it from the employer about, because when you are in orientation, we are not getting reimbursed for your services. So that's why we're paying you half. But it's good for you to know at the beginning so that, we don't have any issues. The other thing is administrative time, aka admin time. What is that? That is the time as a nurse practitioner when you do the non-clinical work. That includes, you have an inbox, aka an in-basket. What that means is that you have all your lab results in there, all your imaging results in there, all the refills, like your patients want some refills for certain medications, it's in that in-basket or in that inbox. You have communications from other providers, other healthcare providers in your in-basket. So when you have admin time, that's the time that you can sit at the desk instead of seeing patients, and then you are going through and getting that done, because no employer wants to see you have a full in-basket. You always want that to be empty. So that's why you need that admin time or administrative time. Also at that time too, your schedule is blocked. What that means is that no patient is put for you to see. You're not seeing any patients. This is the time you're dedicating to your non-clinical stuff. So make sure you know that what that would be before you take a job. Because sometimes people are told to be working, they're going to be working Monday through Friday, 40 hours a week, and that's it. Of course, you end up working 60 hours, 80 hours a week on your own time. So you need to know that. Because when you know more about admin time, what that also means is that some employers will give you 4 hours of admin time. What that means is you want the job to be working 40 hours a week, but really you are working 36? You are working 36 so that the 4 hours are dedicated to that. So either they will say, okay, take Friday, from Friday just work till 12 and that's it. And then the rest of the day stay here and do this and do that. Some employers will want you to stay at the facility and do your admin time. Some don't mind if you do it at home. And then some employers will say, you know what, we're paying you for 40 hours, but we want 8 hours to go to your admin time. So what that means is you are working 32 hours, but you're getting paid for 40 hours or whichever the case may be. So it's very important because for your sanity and for you to be a good provider, you really need that admin time, or aka administrative time. And then you also need to know, do I need a DEA number to prescribe controlled substances? Because some jobs you don't need to prescribe any controlled substances. So if you don't need to control, then you don't need a DEA number. And then some people too, when they graduate, I need to get my DEA number. No, you want to wait till you get employed, right? Most of the time, because some employers will even pay for it because that stuff is expensive. It's around $888 or something for 3 years. Also, remember, the DEA number is only good for one state. So let's say you are in the state of Florida, you get a DEA number, and then you are moving to Georgia, then you have to get another one. So just so you know, they are not transferable. Okay, so DEA number, if you need it, you can. If you don't need it, you don't really need to get it. Or most employers will pay for it. And then your insurance. Everybody needs malpractice insurance as a nurse practitioner. But there are two types. The claim-based malpractice insurance will only cover incidents when you are still working and when the premiums are still being paid. So if you leave that employment, guess what? You have to, for the rest of your life, keep paying for what extra fee, which is known as stay coverage. The other type of insurance is occurrence-based insurance, and with the occurrence-made malpractice insurance, it covers you all the time, even when you stop paying premiums. So it's good to make sure that your employer, when they are paying, are they paying, going to pay for the occurrence-based, or is it going to be claims-based insurance? Malpractice insurance. Some people also get their own coverage. Let's say the employer has covered you with malpractice insurance. Some other providers also get their own malpractice insurance. So, that's a personal decision. Then, paid time off, PTO. The PTO, most of the time, is separate from sick days. Okay, so you want to know at the beginning, is it going to be combined with your sick days or this is separate? Some employers will say, okay, you have PTO time of 3 weeks and then you have 5, 6 sick days, which is additional to your paid time off or PTO. So always remember that. Also, when you talk about paid time off, you want to make sure that CME that we talked about, continuing medical education, okay, maybe I have my 3 weeks for my PTO, but I'm also going to give 5 days additional for my CME attendance, conferences, and is that going to be paid? So it's good to always know these things so that you are not going to have surprises at the end of the day. And also, there's another thing that you hear about too, when I say, especially as a new nurse practitioner, when you get a job and they're talking about RVUs. And what is RVUs? It stands for relative value units. Okay, these are systems that they use to determine the services that we offer. So some will tell you, okay, well, after you've done here and done that, if you pass these RVU numbers, then you get a bonus. So that needs to be explained too, so that you know, because some places when they're offering you those bonuses, then they cut the salary off. Instead of paying you maybe 100,000, they will say, okay, you are getting 85, but make sure that you are going to be paid bonuses. So you need to know that. Another thing as a new nurse practitioner you hear about is the non-compete clause. That means that some employers will tell you, when you leave our employment, you are not going to work, far in the 5-mile radius, or you are not going to work 30 miles, around our clinic or our facility. Or if they have several other satellites, you are not going to work, 60 miles, in around our location. Mind you, some places, if you sign some of these non-compete clauses, you will not even work in the town again. You will not even work in that state. So you need to make sure you know. I, for one, I prefer a job that doesn't, require non-compete clause, because, you don't want to be searching for jobs everywhere, because some of these organizations are expanding. Yesterday, maybe you were working, they were 30 minutes away, now and they have a location next to you. So are you also going to be, signing a non-compete agreement for that clinic near you too? So you want to make sure you know that very well, because it's a lot of frustration. Some people, they will have that and they will even tell them, and it's good for 1 year. You cannot work within certain miles from our clinic for 1 year, 2 years, 3 years. What are you supposed to do? You're supposed to move out of town or something, or out of the state. So you want to be very careful with that. The other one is, you want to make sure your health insurance is covered. Are you covered or are you not? Or if you are covered, is that going to be at a good rate, or is that going to be at a very high rate? Or if your spouse or your partner has a great insurance outside of, that you are already enjoying, do you still take the insurance at this job? And if not, are they going to compensate you? Those are things you want to find out. Will they compensate you for the time that you are going to be, working there, for that insurance, since you are not getting their coverage? How long before you will, start on the retirement? Because me, I'm all about retirement, whether you are 20 years old, 30 years old, you want to start thinking in that way, because the money will accumulate, the money will compound, because you are preparing to when you are not able to work, or when you want to retire and, enjoy your life a little bit. So you want to start thinking about that, from day one. So, and then of course, what is the matching rate? Are they going to match? And even if they're not going to match, the fact that you are still contributing, you go ahead and contribute. That will help you save some money. Okay. So I'm sure I've exhausted all this, but just remember that before you get a job, you want to get some of these questions answered. And the one that really get me a lot, what I see a new nurse practitioner going through stress and even quitting jobs, is the one about the orientation. The orientation period. They don't always get that, cleared. And then as soon as they start, all of a sudden, bam, they're throwing you into the fire, in the fire like that. So you want to make sure you get a clear understanding of how your orientation process will be. Anyway, have a great day, and don't forget to subscribe and come back. My job is to make sure you are a solvent nurse or nurse practitioner. Don't be working on your life and then have nothing saved, So we need to make sure that we're taking good care of ourselves now and in the future. Okay, have a great day. Bye bye.